2, 3, go.
Hi, my name is Sarita. I'm going to be conducting your ear and eye exam. Do I have your verbal consent to do so?
Yes.
All right, very good. So for the first part of this exam, I'm going to do your vision screening. It's on the Shaunella's eye chart. This is for cranial nerve 2. All right, so do you wear glasses or contacts?
Yes.
Okay, so I'll have you to put your glasses on. Very good. The patient is 20 feet away and vital signs are normal. All right, so the first thing I'm going to have you to do is kind of read this chart at the lowest level that you can see the letters. Would you like to start here?
Yes.
Okay.
FELOPZD.
Very good. Let's go to the next line.
DE.
Oh, I'm sorry. Let me have you to cover your right eye.
Okay.
Very good. Let's start over. All right, so start here for me.
FELOPZD.
Very good. Let's go to the next line.
DEFPOTOC.
Okay, can you read this bottom line? That's okay. Go ahead and cover your other eye up for me. All right, so let's start here.
DEFPOTEZ.
Very good. And what about this line? Can you read below? No? Okay. So based off what you were able to read, I would say that you are 20/25 in both of your eyes. Okay? All right. So for the next part of the exam, I would like to, you can take your glasses off. I'm going to take a look at your eyes, okay?
Okay.
I'm first starting off by looking at your lacrimal apparatus. I'm just going to look, and then I'm going to palpate. I don't feel any lumps, and I don't see any excessive drainage, okay? And your lashes and your lids look symmetrical, and they're moving equally. The next part of the exam that I would like to do is look at your conjunctiva sclera and sclera. So I would like for you to look up, down, to the side, and to the other side. Very good. All right. So no irritation noted. Didn't see any signs of jaundice, and the sclera is clear. Okay? And so the next part of the exam is accommodation. I would like for you to take a look at this pen light and just follow it with your eyes, okay? Very good. All right, thank you. So the next part of the exam is I'm going to check your extraocular motion, and this is cranial nerves 3, 4, and 6. And I'm going to have you to do the same thing. I'm going to have you to follow the pen light, okay? Very good. So with the extraocular motion, there's no lid lag or no nystagmus. So I'm going to backtrack. I'm going to check your pupils, okay? I'm going to turn the lights off for this exam, okay?
Okay.
All right, so what I would like for you to do is just kind of focus on this up above my shoulders. Focus on that picture on the wall, okay? Just look straight ahead. Very good. Okay. Okay. All right, very good. So both your pupils are equal, round, and reactive to the light, okay? The last part I would like to do is called the cover test. I'm gonna have you to cover your right eye for me. Look straight ahead. All right, so I'm gonna have you to, I'm gonna hold my fingers up and just tell me how many fingers you see.
2. 2.
Okay, very good.
2.
Look straight ahead.
Ooh.
That's okay.
3.
Okay, very good. Uncover that eye and cover your other eye up for me. We'll do the same, okay? Look straight ahead.
2.
Okay,
2.
all right. Look straight ahead.
2.
Okay,
2.
okay. All right. That's okay. So with this test, I didn't notice any muscle eye weakness on that test, okay?
Okay.
So the last part of the exam is I would like to look in your eyes with the ophthalmoscope, okay? All right, so I'm going to, first of all, I'm going to look and I'm checking for a what's called a red reflex, okay? Okay, the red reflex is noted in the right eye, and I'm using my right eye to look inside of hers. Left eye. Okay, red reflex is noted there as well. All right, so I'm gonna take a closer look inside of your eye, okay? Look straight ahead for me. Open nice and wide for me. Very good. Red reflex is noted. All right, I visualize the blood vessels, clear margins, and no signs of hemorrhaging. Very good. All right, so I'm gonna take a look in the opposite eye, okay? Look straight ahead for me. Okay, the red reflex is noted here. I'm just going in a little closer. All right, so the blood vessels, no sign of hemorrhage, and the margins are well defined. The optic is, and don't see the macula here either. So, all right. So that part of the exam is done. The next part I'm gonna do is I'm gonna check your ears, okay? So I'll start by inspection. I'm just gonna take a look at the auricle on the outside, the anterior and the posterior. I'm gonna palpate with my finger along the auricle down to the lobe and the tragus. No signs of lesions, and there's no tenderness, right? No pain? Okay. I'm gonna have you to cover your left ear for me. I'm gonna do cranial nerve 8. Can you hear this?
Yes.
Okay, very good. So you can uncover that ear. The next part of the exam is I'm gonna take a look in your ear. All right, so I'm just gonna brace my hand right here. I'm pulling up and back just so I can get a good visual inside of her ear. All right, so very little wax. I can see it's very, well, no sign of any infection, no edema, no erythema, good cone of light, and the tympanic membrane is pearly gray, and everything looks really good. So I'm gonna come out, okay? All right. So I'm gonna do the same thing with the opposite ear. All right, so I'm just visualizing. You wanna come over here so she can see? All right, so I'm just visualizing the outer part of the ear, the auricle, all the way down to the lobe and the tragus. No signs of lesion, posterior, anterior, and no pain, just palpating. Any pain or tenderness?
Nope.
Nope. Okay.
Nope.
Very good. I'm gonna have you to cover your opposite ear. You hear that? Very good. All right, so I'm just going to look inside of the ear. Thank you. All right, so I'm just gonna pull up and back to get a good visual. All right, so this ear is nice and clear. No erythema, no edema, no signs of infection, and I've got a good visual on your tympanic membrane. It's pearly and gray and a good cone of light. This ear looks really good, and yeah. So I'm coming out, very good. Oh. All right, so for the last part of the exam, I'm going to do what is called a Weber's test, okay? I'm gonna bring this tuning fork and I'm gonna put it on the top of your head. You let me know if you can hear it equally in both ears, okay?
Okay.
Can you hear it equally in both ears?
Yes.
Very good. So that's positive for lateralization. All right, so I'm gonna do, that's the Weber's test, so I'm gonna do the Rhines test. So basically I'm gonna do the same ringing, but I'm gonna put it on the back of your ear. Let me know when you can hear it and when it stops, okay?
Yes.
It's on the mastoid bone. You hear it?
Yes.
Okay, let me know when it stops.
Stop.
And you hear it there?
Yes.
Okay, very good. So it's AC is greater than BC. The air conduction is greater than the bone conduction. And I will go ahead and do the same thing over here. So I have it on the back of the ear. Do you hear that?
Yes.
All right, let me know when it stops.
Stop.
Okay, and do you hear it there?
Yes.
All right. So thank you very much for allowing me to do your exam, and we are done.
Thank you very much.
Good.
Yep.